Welcome to Mental Health Resilience for Nurses. Knowledge Bite 2. Knowledge Bite 2 outlines the difference between pressure, stress, and anxiety, types of anxiety disorders, signs and symptoms of anxiety disorders, effects and consequences of anxiety, prevalence of anxiety disorders, and COVID-19 pandemic and anxiety in healthcare workers. COVID-19 pandemic and anxiety in healthcare workers. Knowledge Bite 2 Learning Outcomes. After working through this knowledge bite, you should understand the concepts of pressure, stress, anxiety, and anxiety disorders. Be able to list different types of anxiety disorders. Know the signs and symptoms of generalized anxiety disorder. Knowing the important consequences of an anxiety disorder. Knowing how common anxiety disorders are, and having an understanding of the impact of COVID-19 pandemic on anxiety and healthcare workers. Pressure, stress, and anxiety. Pressure can be from many different sources, including work, interpersonal, financial, or physical. The amount and intensity of pressure varies throughout life. High pressure situations can be a normal part of life. For example, relocating, a new job, divorce, or death of a loved one. Stress is a natural response to pressure. It may help resolve challenging situations. Fight or flight is a response. Our minds and bodies are wired to use short periods of stress to get out of danger. When pressure is excessive and or persistent, it may cause an unhealthy stress response. Our mental resilience helps us to deal with this stress. Sometimes the pressure is too much and or our resilience not robust enough. This may result in an abnormal stress response, which may lead to anxiety disorders and depression. Stress response becomes abnormal when it is persistent and starts affecting our ability to function, including at school, work, or in relationships. Different types of anxiety disorders include generalized anxiety disorder, or GAD, post-traumatic stress disorder, PTSD, obsessive compulsive disorder, OCD, phobias, and panic disorder. When the stress response becomes persistent and affects a person's daily activity negatively, an anxiety disorder may be present. There are different criteria to diagnose different types of anxiety disorders. DSM-V diagnostic criteria for generalized anxiety disorders are excessive anxiety and worry, excessive anxiety and worrying for more than 6 months. Worry is difficult to control and are accompanied by at least 3 of the following: edginess or restlessness, fatigue, poor concentration, irritability, muscle aches, and difficulty sleeping. Symptoms not due to medication or another condition, for example, physical and substance abuse. And symptoms affect day-to-day functioning, for example, work or relationships. Even when anxiety disorder is not present, pressure and the stress response can vary and occur on a spectrum. Some people may not meet the criteria for an anxiety disorder, but that does not mean that they are not experiencing significant stress. Even in the absence of an anxiety disorder, most people can benefit from healthy practice to manage stress level and prevent them from escalating. This is especially true during unusual stressful times, like when dealing with other illnesses, divorce, job changes, and etc., or when working in a high-stress job like healthcare working, policing, and etc. Consequences of anxiety are as follow: the stress and impaired quality of life, impaired functioning at work, relationships, and education. Physical anxiety disorders are associated with higher rates of thyroid disease, respiratory disease like COPD, gastrointestinal disease, arthritis, migraine headaches, allergic conditions, heart disease, and hypertension, and having the body in a constant state of fight or flight. It also has a consequence of a higher risk of substance abuse and increased risk of suicide. How common are anxiety disorders? Anxiety disorders usually start at an earlier age than depressive disorders, even before the age of 10. South Africa in 2008 has an overall lifetime prevalence of anxiety disorders at 15.8%. According to the World Health Organization, in 2019, 301 million people worldwide were living with anxiety disorders. This number has increased significantly during the COVID-19 pandemic, and the estimated increase of 20% in just 1 year, 2020, and a greater increase in females than males, probably because the great effect of socio-economic consequences of the pandemic on females, and a greater increase in younger age groups because of the impact of school closures and social restrictions. Anxiety disorders in healthcare workers. During the COVID-19 pandemic, the prevalence of anxiety amongst healthcare workers over 35 countries was 22 to 33% healthcare workers, 17 to 19.8% doctors, 22.8 to 27% nurses. Another study found a prevalence of 21% for PTSD among healthcare workers during the pandemic. The MHA survey of 2020 among healthcare workers found 93% experienced stress, 86% experience anxiety, 76% exhaustion and burnout, 75% are overwhelmed, worried about exposing loved ones, 47 to 76%, 70% have trouble sleeping, 57% had a change in appetite, 56% had physical symptoms like headaches or stomach aches, and 52% has compassion fatigue. In the next Knowledge Bite in this course, we will explore more ways to deal with pressure, stress, and anxiety